Have you ever wondered why you or a loved one keeps waking up at exactly 3 a.m.? The clock hands carve the dark, your eyelids snap open, your heart beats a little faster, your breath grows just a touch heavier. Many people think it is simply aging, but the truth is that your body is sending a quiet signal, a reminder without words. And here is the surprise. There may be at least 5 serious conditions behind this pattern, from the lungs and the heart to blood sugar and even the brain. When you understand the body's message, you will know what to check first and what to change right now. Stay until the end, because cause number 5 can appear 10 years before memory even begins to fade. Miss it, and you miss a golden window for prevention. Welcome to Senior Life Advice. Here, we talk about health in the most down-to-earth, practical way, so you can feel confident caring for yourself and the people you love. In this video, we will go straight to 3 questions that have many families puzzled: why older adults so often wake right at 3 a.m., which 5 medical conditions may quietly stand behind it, and most importantly, what older adults and their families can do tonight to improve sleep and protect long-term health. This is not a diagnosis. It is knowledge to help you have a better conversation with your doctor when needed. If you have ever felt that knot of worry when a loved one lies awake at 3 a.m., then right now, take a deep breath, keep an open mind, and let us decode the signal your body is trying to send you. 1. Lung dysfunction. Waking up short of breath at 3 a.m. is not random. Your body is ringing a small bell, steady and on time, and your lungs are the first place that bell begins to sound. Older adults often wake between 3 and 5 in the morning. In traditional medicine, that window is called the lung hour, while modern medicine sees sleep, breathing disorders behind it, such as obstructive sleep apnea and chronic lung disease, including COPD or asthma. As you age, your lungs slowly lose elasticity like a rubber band that has been used for too long. The breathing muscles weaken, and the airway collapses more easily. Air moves in and out with more effort. The snore grows thick and heavy, and the rhythm of breathing breaks. Each time the airflow is blocked, your brain flips into an alarm mode to pull you up from sleep to reclaim oxygen. That is why many people bolt upright in the middle of the night with a tightness in the throat, a gasp for air, or the need to prop themselves up just to breathe. This is more than an annoyance. Studies show a substantial share of people over 60 live with some form of sleep, disordered breathing, and when it is ignored, the picture that follows can be rising blood pressure, an overworked heart, and a health span that quietly shortens day by day. Try a quick self-check and be honest with yourself. Do you snore so loudly that a bed partner has to nudge you awake? Do you sometimes pant as if you had climbed a hill while you are lying still? Or do you jolt awake toward dawn with the sense that there is not enough air? If your answer is yes to any of these, it is time to move this to the top of your list. The medical name for what you may be facing is OSA, obstructive sleep apnea. It does not only steal deep sleep, it silently drags down your blood oxygen, pushes your heart to beat harder to compensate, makes blood pressure more difficult to control, and leaves your brain fatigued and your memory foggy during the day. You may notice a dry throat, a head that feels wrapped in mist, and a sluggishness that lingers even when the hours in bed seem sufficient. That is the cost of those repeated moments of not breathing through the night. The good news is that there are very concrete steps you can take right now. Begin with an appointment with a pulmonary or sleep specialist if you have the signs above. Describe the loud snoring, the gasping, and those abrupt early morning awakenings. If a diagnosis is made, you may be prescribed CPAP, a device that keeps the airway open with gentle positive pressure, letting air pass through the throat the way water moves through a tube that is not pinched. Many people notice the difference after only a few nights: fewer awakenings, a lighter head in the morning, sharper focus through the day. In parallel, give your lungs a little more room with friendly habits. When your body allows, practice regular, gentle movement to expand lung capacity and strengthen the breathing muscles. Say goodbye to cigarettes to reduce airway inflammation, and limit evening alcohol because it relaxes the throat muscles and makes collapse more likely. When you get into bed, try sleeping on your side instead of your back so gravity does not press down on the airway. And do not forget to care for the air in your bedroom. Keep the space clean and well ventilated. Steer clear of fine dust, smoke, and pet dander. and avoid an overly cold temperature that can tighten the airways. You do not need to do everything in one night. You only need to start tonight with one thing you can do. The key is to hear what your body is saying and answer it in time. If you or someone you love has ever snapped awake in the dark because breathing felt hard, leave the number 1 inch the comments so I know you are here, and we will keep going together. And if you have done everything you can for your lungs and still find yourself staring at the clock at 3 a.m., do not lose heart. The story may not be in your breath. It may be in your blood sugar. 2. Diabetes. If you often snap awake at 3 a.m. with a throat that feels parched, a thirst pressing down on your tongue, or the need to shuffle to the bathroom more than once, do not rush to wave it off as normal aging. Your body is whispering a message that is clearer than you think. This may be an early warning of diabetes or prediabetes. When blood sugar is disrupted overnight, your brain and hormones move like an emergency shift, sleep is fractured, your body clock wobbles, and 3 a.m. turns into a recurring appointment that is hard to ignore. Behind those awakenings are 2 very different mechanisms that can pull you out of deep sleep. A healthy body naturally readies for morning by releasing hormones like cortisol and glucagon from about 3 to 5 a.m., nudging blood sugar just high enough to prepare for waking. People without diabetes adjust smoothly. But when glucose control is impaired, the gas pedal kicks in while the brakes fail and blood sugar overshoots. That is the dawn phenomenon. On the other hand, if medication, insulin, or a skipped dinner drives your blood sugar too low around midnight, your body flips into rescue mode, surging hormones to push sugar back up. That rebound can overshoot, jolting you awake with a racing heart, a light sweat, and a hard time falling back asleep. That is the Somogyi effect. 2 different paths, 1 destination. Your brain is sacrificing sleep to keep your metabolism in balance. This is not only about a rough night. When blood sugar keeps interrupting sleep, the architecture of rest breaks down, you spend less time in restorative REM, and morning arrives with a head that feels packed with fog. Daytime fatigue slows your reflexes, blunts your memory, and in older adults, clearly raises the risk of falls. The deeper concern is the vicious loop that follows. Diabetes makes you lose sleep, and poor sleep makes diabetes harder to control. Night after night, every 3 a.m., awakening tightens the knot on your metabolic health. Ask yourself tonight, do you feel unusually thirsty before bed? Do you wake multiple times to urinate? Do you struggle to fall back asleep after 3 a.m.? And do you feel more sluggish than usual during the day? If your answers lean toward yes, your body is asking for a new plan. That plan begins with very specific steps. You can track your blood sugar consistently in the evening and again upon waking to see what is truly happening. If you have access, a continuous glucose monitor can record the overnight rises and dips that the eye cannot catch. When the common pattern is a 3 a.m. peak, it is time to talk with your clinician about timing and doses, so you can avoid both midnight lows and the near-dawn surge. If you are prone to nighttime hypoglycemia, a small, balanced snack before bed such as a little milk or whole-grain cereal can serve as an anchor that keeps sugar from plunging. And to strengthen the long-term foundation, you still need the habits that are not flashy but are effective. Maintain a healthy weight, move your body regularly within your limits, and go easy on sweets in the evening so you are not pouring fuel on the fire right before sleep. You do not have to change everything in a day. You only need to start tonight with one simple action that you can do. If someone in your family lives with diabetes and often wakes in the middle of the night, leave the number 2 inch the comments so we can share experiences and walk together as we reset both sleep and blood sugar rhythms. And here is the dangerous part. Even if you do not have diabetes, a tired, struggling heart can still be the force that wakes you in the dark. That is the third cause almost no one notices. 3. Cardiovascular disease and heart failure. A single missed breath at 3 a.m. can begin in the heart. If you often snap awake with a sense of tightness, a dry cough, or repeated trips to the bathroom while the sky is still dark, treat it as a serious reminder rather than a small nuisance of age. Many people describe the same scene. After only 2 or 3 hours of sleep, they have to sit straight up to breathe, as if something heavy were pressing on the chest. That is paroxysmal nocturnal dyspnea, the sudden nighttime breathlessness that appears when the cardiovascular system, especially a weakening heart, is asking for your attention right now. When you lie down, the body quietly redirects a current. Fluid shifts from the legs toward the chest, and both lungs and heart receive an extra load. The lungs can become congested, each breath grows shallower, the cough lingers, and your fingers clutch at the sheets in search of more air. At the same time, the kidneys work harder in the lying position, pulling more fluid into the bladder and sending you out of bed again and again. The combination of breathlessness, dry cough, and nighttime urination is not a bad habit. It is the picture of a heart that is overworked. Most important of all, PND and shortness of breath at night often emerge as heart failure progresses. This is not the moment to delay. You need a timely visit with a cardiologist for a thorough evaluation and a plan that fits your condition. Try a small check on yourself tonight. Do you need extra pillows to breathe more easily when you sleep? Do you notice sock marks at your ankles by evening? Do you wake feeling unrefreshed as if you never truly slept? Or after midnight, do you feel unusually thirsty and then find yourself heading to the bathroom more than once? If your answers lean toward yes, your heart is sending a call for help. Do not blame yourself for not seeing it sooner. The body speaks in repeated signals, and 3 a.m. is a simple marker that helps you start acting. Action does not have to be complicated, only clear and steady. The first step is to see a cardiologist when nighttime shortness of breath keeps returning, especially if it comes with leg swelling or daytime fatigue. The right assessment leads to the right course of treatment, which may include medications your doctor prescribes, such as diuretics to lessen fluid overload, ACE inhibitors to support heart and vessel function, or beta blockers to help the heart work with less strain. Alongside medication, your dining table is a daily place of protection for your heart. Cut back on salt so your body does not hold on to excess water, and ease up on fluids later in the evening so your bladder does not call you out of bed again and again. Keep working toward a healthy body weight so your heart is not asked to haul a heavy load with every step and every night. When you get into bed, do not force yourself to lie flat if breathing feels tight. Elevate your head with extra pillows or rest slightly on your side to relieve pressure on the heart and lungs so each breath feels less heavy and sleep can settle back in. You do not need to change everything in a single day. Choose one thing you can do tonight. Book the appointment, cook a dinner that is lighter on salt, pour a smaller glass after 8 p.m., or set out one more pillow for a more comfortable position. Each small step lays another brick in the foundation of steadier sleep and stronger cardiovascular health. If you are still here, and this information has helped you, leave the number 3 in the comments, so I know you are with me, and together we will turn 3 a.m. from a moment of panic into a reminder that you have started to care for your heart the right way. And if you are a man over 50, there is another extremely common culprit behind broken nights, and it often lies in a place you might not expect: the prostate. 4. Prostate problems in men. Waking up at 3 a.m. to head to the bathroom night after night is not a habit of old age. For men over 50, it is very likely the footprint of a prostate that is quietly enlarging and taking control of your sleep. When the prostate grows, the urethra feels cinched like a tightened ring. The bladder never empties fully, and the urge to urinate returns on a loop. You drift off for 2 hours, the clock brushes 3 a.m., your body urges you to stand, and the night splits into scattered fragments. The mechanism behind it is simple, yet stubborn. The prostate sits just beneath the bladder and wraps the urethra like a band. When it enlarges, every stream slows. The bladder strains to squeeze and still leaves urine behind, so the brain sends the command to go again. The first few nights are merely annoying. In the weeks that follow, the brain adapts to that wake-up rhythm. Deep sleep gets interrupted, and daytime arrives with a heavy head, a short fuse, and a memory that slips. The harsh truth is that most men past 50 will face this. At first, it only steals hours of sleep. Over time, stagnant urine becomes a welcome mat for bacteria, infections take hold, sediment hardens into stones, and back pressure can overwhelm the kidneys. There are signs you must not ignore: an unusually weak stream, blood mixed into the urine, or unexplained weight loss. When those red flags ride alongside relentless nighttime urination, you need to consider the harder scenario: prostate cancer in its early stage. Give yourself a small check tonight. Do you wake 2 to 4 times each night? pass only a little each time, finish but still feel incomplete, and find that around 3 in the morning is your typical awakening. If your answers lean toward yes, it is time to put your health in the right order of priority. The first step is not gritting your teeth. It is getting a clear answer. An appointment with a urologist will give you a specific picture, an exam, a PSA test when needed, and an ultrasound to measure the prostate and assess the degree of blockage. Once the cause is clear, the path forward becomes straightforward. In many cases, medications that relax, smooth muscle, or reduce prostate size ease symptoms noticeably. For more severe obstruction, interventions such as transurethral surgery can open the bottleneck, restore a free pathway for urine, and give you back an unbroken night. Alongside treatment, your evening habits are the lever you can pull right away. Do not load the bladder with extra fluids after dinner. Steer clear of coffee and alcohol because they drive urination and shred sleep. When you are able, practice pelvic floor work like Kegels to improve control of the stream. That sense of agency builds confidence that your body still listens to you. And as you step into the bedroom, notice one small detail. Simply slowing down that last sip of water or skipping a late coffee can spare you one unnecessary awakening. You do not need to overhaul your life in a single night. You only need to start this evening with one action you can take now. Book the appointment. Speak plainly with your doctor about those 3 a.m. trips. Shift that late-night glass to daytime, or begin a short set of Kegels before bed. Each small step lays another brick toward sleeping through the night and waking clear-headed. If you are a man who has had to get up 2 or 3 times every night to use the bathroom, leave the number 4 in the comments so I know you are here, and we will walk together as we reset the rhythm of the night. And if you have checked your lungs, your blood sugar, your heart, and your prostate, yet 3 a.m. still calls you awake, prepare for a tougher but far more important conversation. The remaining culprit may be inside the brain itself. 5. Neurodegenerative disorders. If each early morning you snap awake at exactly 3 a.m., your mind hazy as if wiped clean for a moment and then stitching fragments back together, do not rush to file it under poor sleep. There is a truth few say out loud. Neurodegenerative disorders such as Alzheimer's and Parkinson's can also pull you out of sleep right around that hour. With Alzheimer's, the internal body clock drifts off rhythm, turning sleep fragile and easily shattered near dawn. With Parkinson's, the story grows more tangled. REM Sleep Behavior Disorder can make a person shout, flail, or even get up and walk while still asleep. Both conditions crack the structure that deep sleep depends on quiet and continuity. The concern is not just a single broken night. Sleep disturbances, in many cases, show up before memory begins to fray or a hand starts to tremble, sometimes a full 10 to 15 years earlier. That means those 3 a.m. awakenings can be an opening signal, subtle enough to overlook but persistent enough to mark the path of disease. And when sleep stays fractured, the brain is more likely to collect toxic debris, beta, amyloid in Alzheimer's, and alpha, synuclein in Parkinson's. The loop that forms is harsh. Poor sleep speeds the buildup of abnormal proteins, and that buildup in turn keeps damaging sleep. You wake exhausted, you struggle to focus in daylight, short-term memory slips through your fingers, and by evening the fear of waking again at 3 a.m. makes it harder to fall asleep in the first place. Try an honest check tonight. Do you drift off schedule, get into bed on time, yet stare at the ceiling? Do you have moments of mixing up names or misplacing familiar items? Has your family heard you talking loudly in your sleep, seen you thrash your arms or legs, or watched you sit up in the night and then forget it by morning? If these patterns repeat alongside that 3 a.m. marker, your body may be asking you to take one earlier step. Do not be afraid. This is the moment when knowledge becomes a flashlight in your hand, lighting the road you need to walk. That road begins with a neurological evaluation. If you also notice memory decline, confusion, tremor, or changes in behavior and personality, the sooner you arrive, the better your chance to redesign your daily rhythm to protect what matters most: your memory, your independence, your dignity. At the same time, treat sleep as a therapy you can actively shape. Keep a steady bedtime and wake time each day, as if resetting the hands of your internal clock. Shut off bright screens before bed so the brain is not fooled by a fake daylight. Make the bedroom quiet, comfortably cool, and free of jarring interruptions so your brain can trust that this hour is safe. Do not forget 2 steady companions: mental activity and gentle physical movement. A chapter of a book, a few crossword squares, a light walk, small things that act like a regular broom, sweeping away mental fatigue and helping sleep drop back into orbit more easily. When needed, your clinician may consider supports such as melatonin or medications that adjust REM sleep. But remember this, do not self-medicate. Follow a monitored plan, because the goal is not just to get through tonight, but to rebuild a healthy architecture of sleep strong enough to carry the brain for years to come. You do not have to do everything in a single day. Choose one action you can start this evening. Schedule the appointment, switch the screens off 30 minutes earlier, open a book, or take a few hundred easy steps after dinner. Every small change lays another stone on the path that leads to steadier memory tomorrow. If you have found this helpful and want to protect long-term memory, leave the number 5 in the comments so I know you are still with me. In the end, those 3 a.m. awakenings may be the body's quiet message warning that the lungs, blood sugar, heart, prostate, or the brain itself needs your attention. Understanding these 5 causes is the first step for you and your family to take charge of health and sleep, so each morning begins not with worry, but with the clarity and calm you deserve. Tonight is your 10-second test. If 3 in the morning calls your name again, what will you do? You see, waking up at 3 in the morning is not just aging. It may be a quiet warning from lungs that are struggling, from blood sugar that swings up and down, from a heart working too hard, from a prostate that blocks the way, or from a brain sending early signals. The difference is whether you ignore it or treat it as your body's kind alarm bell. When you pause to listen, you step off the path of "it will pass anyway" and move on to the path of actively protecting yourself. You do not need a difficult overhaul. Start with one small action today. Book a checkup to review the issues we discussed. Adjust your lifestyle in a healthier direction, or improve your sleep hygiene tonight. One tap to schedule an appointment. One decision for a lighter dinner. One consistent bedtime and a calmer bedroom. Small changes that open a long, steady journey. If you want to go deeper and get steps you can use right away, I suggest the next video, 7 habits that help older adults sleep better every night. You will get simple steps you can put into practice tonight for calmer sleep and a clearer morning. I would love to hear from you. What will you apply starting today to sleep better? Please share in the comments. Your experience might be the key that helps many others sleep through the night. If you found this video helpful, please press like and subscribe. Your support helps us continue creating quality content that helps the older adult community live healthier, more proactively, and more meaningfully every day. Finally, a safety reminder. The content in this video is for education and knowledge sharing, and it does not replace personal medical advice. If you or a loved one have persistent symptoms, please see a doctor for proper evaluation and treatment.